Hi guys, so I have childhood HIV for my presentation. So to start off, what is HIV? So this is a virus that attacks the CD4 cells whose job is to fight infection in certain cancers. HIV then multiplies and spreads throughout the body, and so without treatment, it can eventually advance to acquired immunodeficiency syndrome, otherwise known as AIDS. AIDS is the most progressive stage of HIV, and you can see in that chart kind of the differences between HIV and AIDS that you might not be familiar with exactly what the difference is. So let you go ahead and read that if you'd like. Next, transmission. So HIV is spread through either vertical or horizontal transmission. Vertical transmission is also referred to as perinatal or mother-to-child transmission. Vertical transmission occurs during gestation, during delivery, or during breastfeeding. This type of transmission is also most common for children under the age of 13, and it is important to note that not everyone who is pregnant with HIV will pass it along to their child. So that's really good news. Usually if the mother is on some sort of treatment that we'll talk about later, they do not have a high chance of passing that on to their child. So the next type of transmission is horizontal, and that occurs when there is direct contact with semen, vaginal fluid, or blood. So this can occur through obviously vaginal, oral, or anal sex without a condom, or through sharing needles or syringes. So this type of transmission is the most common way for teenagers to contract HIV. And with a large stereotype surrounding HIV, it is important to clarify that HIV cannot be transmitted through things like kissing, sweat, toilet seats, insects, hugging, shaking hands, as you can see in that diagram right there. So next off is the stages of the HIV infection. There are 3 stages: the acute stage, the chronic stage, and AIDS. The acute HIV infection refers to around 2 to 4 weeks after the initial infection. During this stage, the individual may experience flu-like symptoms, so a fever, rash, aches, things like that. And these symptoms could last for a couple of days or up to a couple of weeks. During this stage, the individual has a high level of HIV in the blood, and so they also have a high risk of transmitting HIV during this stage. Chronic HIV infection refers to when the HIV multiplies. However, it is at very low levels when compared to the acute stage. Individuals in the chronic stage may not experience any symptoms related to HIV. However, without treatment, chronic HIV can advance to AIDS in around 10 years. So it takes a long time. But so after an individual is diagnosed with AIDS, the body is no longer able to fight off infections or certain cancers. Individuals with AIDS have a CD4 count of less than 200 cells per cubic milliliter. And without treatment, individuals who are diagnosed with AIDS, on average, only live to about 3 years post-diagnosis. So on to symptoms of childhood HIV. So symptoms include a large array that vary depend on the age of the individual. So symptoms of children who are older than 1 can be categorized into mild, moderate, or severe. So mild symptoms include swollen lymph nodes, swollen glands, reoccurring sinus infections, reoccurring ear infections, dermatitis, and abdominal swelling. Moderate symptoms include pneumonias, oral thrush, reoccurring diarrhea, fever, chickenpox, kidney disease. And then severe symptoms include 2 serious bacterial infections in a year, span yeast infections of the digestive tract or lungs, tumors, and all of that listed there in that column. And if the individual does not experience any symptoms throughout their diagnosis, transmission is still possible without specific treatment. So how is HIV diagnosed in children? So the disease progression occurs rapidly within the first few months of children who are under 1 year old and who are born with HIV. The child's first appointment within a healthcare facility before 6 weeks old usually should be a serological testing, and so that is in order to determine the HIV exposure status. This includes asking the mother about HIV testing, checking the child or mother's healthcare card, and offering a rapid antibody test to all children whose status is unknown. Viral testing can also be conducted within 4 to 6 weeks, and children at 6 months are able to start ART therapy, which we'll talk about in a little bit. Children under 1 year old should also undergo repeated tests due to difficulty in diagnosing HIV at this age. And children who are over 1 year old should have a viral diagnostic test from blood samples and HIV and antibody testing from blood samples at around 18 months. Severe symptoms of HIV may not make themselves apparent, although for 10 or more years in children. So, treatment of HIV. So, ART is a treatment. It's not a cure for HIV. That includes a combination of medications that are taken daily. And this helps lower the viral load of HIV and can help fight off infections and certain cancers. So, ART basically helps prevent HIV from multiplying and allows the body to produce more of those CD4 cells, which in turn boosts the immune system. There are 24 antiretroviral drugs on the market. And then depending on comorbid conditions, drug resistance, allergies, and the individual's needs, etc., this will depend on which medications are put together to make the HIV regimen. So basically every single person with HIV is not going to have the same treatment because it uses a combination of drugs to help treat them. So since ART reduces the viral load of HIV in the individual's system to an undetectable viral load, women who are pregnant and are being treated with ART have a less likely chance of transmitting HIV to their baby, which is great news. So this is just a diagram kind of showing the different subtypes of medications that there are out there to treat HIV. And then also the link below there is one that I used a lot for this research, and I highly suggest you, if you need any more information or want to know anything more about HIV, it goes into great detail. So I would check that out if you are interested. Some considerations. So drug resistance can occur due to medications being unable to control the HIV from multiplying because it continuously mutates. So drug resistance testing can be done to help decipher what medications should be included in the individual's beginning HIV treatment. Medical adherence refers to starting a treatment, taking the medications timely and in a precise routine, and going to all your medical appointments. So if an individual adheres to their medical plan, the risk of the drug resistance is decreased. And there are many reasons why an individual may not adhere to their medical plan. In 2015, I will say that the FDA approved oral pellets that can be opened and spread over food or dissolved into liquid rather than difficult to swallow pills for children. So I mentioned that because medical adherence isn't always one answer. It can be multiple things that I've listed under there. So it's not only just because, I don't want to go take my medications. It's actually like maybe the child can't swallow their food. So like these pellets are going to help. HIV also comes with a stigma surrounding it, causing children to face discrimination and bullying. So since there is a lot of inaccurate information around HIV, This leads to individuals believing in false transmissions and not understanding that children living with HIV can have a typical healthy lifestyle. So this overwhelming stigma may account for some individuals not accepting their diagnosis and thus not adhering to their medical plan. In some cases, medical non-adherence may be out of the child's hands. Children who have an unstable living environment may not have access to receiving daily medications or medication in general due to lack of health insurance. That goes back to medical non-adherence. Parents with busy schedules may have a hard time getting their child to the daily medications that they need. In high-income countries, the market for HIV medications has almost disappeared because of how it is not transmitting, because these individuals of high-income communities are able to afford the medication and thus lessen their chance of transmission. And so this kind of eliminates the likelihood of these companies to keep doing research and funding for new medications, because the high-income populations are the ones who are going to buy it versus the low-income countries who can't afford it, and they also can't get their information out to them as easily. Like I said, companies are not as motivated as developing their new medications for individuals in low-income countries. So just something to think about. I kind of said that a little weirdly. But anyways, side effects of HIV medication also plays a part in why some individuals may not adhere to their medical plan. Some common side effects of HIV medications are nausea, fatigue, and sleep apnea. However, these side effects usually only last for a short period of time. One long-term side effect might be high cholesterol, but overall, the side effects do not outweigh the help that this medication provides these people with HIV. So here's just some statistics for HIV. 1.8 million were living with HIV, 150,000 were newly infected with HIV. The graph on the right, you can see the stats for children under the age of 15. Nebraska is 33, California is 722. I just thought that this was an interesting visual, kind of to represent. You can also see in the visual on the left how drastic, like these lower income countries, like over 20,000 in parts of Africa. So preventing HIV. There's many ways that you can prevent or reduce your chance of contracting HIV. Obviously, like using condoms, limiting the number of sexual partners you encounter, continuously being tested. One thing I want to bring up is pre-exposure prophylaxis, or otherwise known as PrEP, and is an option for individuals who do not have HIV but are at a high risk for contracting HIV. So they might be using drugs quite frequently. They consistently don't use a condom. They've been diagnosed with STDs. They're just kind of living in a increased risk for getting HIV, for being transmitted to them. So PrEP medication includes these two medications that can be taken daily. And if the individual has PrEP in their system while they also contract HIV, it can prevent the HIV from attacking their CD4 cells, and also can prevent it from spreading by 99%. So that is awesome. And I think that is about it. Here are my references thus far, and thank you for allowing me to share.